So in today's session, we'll be discussing regarding why, what, and how to be a genetic counselor, and what are the possible career opportunities in the life sciences field. Okay, because being pursuing in the field of life sciences, हमें पता ही नहीं होता है कि like what are the different career opportunities or where can I go beside academia. Everyone is trying to follow the path of BSc, MSc, PhD, postdoc, double postdoc until you get a job. So our aim is basically something other than that. And with that aim only, we are conducting this particular session where we have invited Dr. Deepanjana, who is a very senior genetic counselor at Apollo Hospital, carrying more than 14 years of experience in the field and being a molecular biologist. So today we'll be looking at a few of these things, like why, what, and how to be a genetic counselor, and what are the few of the possible career opportunities in the field of genomics and life sciences. So yeah, so basically like who we are. So I told you that like we are basically a company who is working on the intersection of these three domains of academia, industry, and research. So we are trying to train the students in the field of data sciences, clinical data sciences, and bioinformatics. Okay, so we carry the team or having a good experience in these fields, and these people comes from the industry, academia, and research as well. So if you'll ask me like what are the different things that we do, so we train the student for a field which is known as precision medicine. And you know guys, like precision medicine is one of the hottest area of research nowadays, because every industry nowadays and the research labs nowadays want to make a transition to the field of precision medicine. And to the guys who are not aware of the term precision medicine, so this is one of the area where we are trying to design therapeutics based upon the individual genome of an individual. Okay, so we at our company basically trying to train their students with all those core skill sets, after which a student can go into the field of precision medicine or life sciences or clinical data sciences. Yeah, so this is basically the principle of personalized medicine, and it believes that when you are one in a million, then why shouldn't you be treated as one? Okay, so this is basically the philosophy of precision medicine, and nowadays a lot of different research labs is working in these fields. And to work in this particular field, you need to carry a great experience in the field of life sciences, theoretical understanding, as well a great understanding in the field of data science and AI. And we at TechmedBuddy train the students for all these fields. So yeah, and these are few of our past events. Like this is not a first event, so we keep on conducting few events where we call experts in their domain, and we try to create awareness among the society about possible career opportunities or possibilities in the industries. Okay, industry or the academia. So what the students can do. So there are few of our past events, like where we conducted an event. We had invited experts from Roche Healthcare. Then we conducted an event where we invited a speaker from Thermo Fisher, and there are different startups. Also, we conducted an event upon depression topic. What is depression? How to tackle depression? Then we conducted an event in the field of healthcare, TCG data analysis. So these are the few type of event that we keep on conducting to create the awareness among the society. And I will skip the slides. Yeah. So about today's session, like we all of us have heard all these terms: genome, transcriptome, proteome, metabolome, autosomal dominant, autosomal recessive, sex linked, trisomy, polysomy. And these are basically the fundamental words, the concepts, which are there, but we can't see them. Okay. What we see and observe are basically these genetic disorders. The Klinefelter syndrome, Down syndrome, Edwards syndrome, Huntington disease, and many others. And these are the rare disorders. So they are rare genetic disorders, which the scientists are always keep on fighting to find the new approaches to treatment and all of the things. But being genetic disorders, it is very hard to treat them. Okay, and this is where the role of genetic counselors comes into play. That they are basically the persons who can tell when the child is there in the womb of the mother only. By making use of some of the concepts of medical concepts, they can try to predict, do the child is suffering from some type of genetic disorder or not. Okay, so The role of genetic counselor is this only: to aware the society, to predict something in advance regarding the genetic disorders, and keep increase awareness among the society, and make disease free, like genetic disorder free society if it is possible. So this is all about the today's event. So this is what I wanted to speak and introduce. So now I would like to over to you, Dr. Deepanjana. So, and again, I'm very thankful to you for giving out, taking out your precious amount of time to increase the awareness among the society. What is genetic counseling and what is the requirement for genetic counseling? So I'm over to you. Like, thank you so much, ma'am. So over to you. Like, now you can proceed.
Thank you so much. And thank you so much for inviting me over here. So I would like this session to be interactive. I will first speak about my journey, how I landed up being a genetic counselor, and the challenges which I faced. And then we will talk a bit about genetic counseling and the prospects that we have. So I'll just share my slides and we'll go on from there. Just a
Sure, ma'am.
Okay, so the reason I kept this topic as a degree is not enough, is that we all have, like if you have already done a BSc, MSc, PhD, you know, when we were kids, like our grandparents, they would have said ki BSc honors is a huge thing. It's like, you know, only few people are doing it. And MSc honors is like, MSc is something that, you know, only like 5-6 people in the whole world are doing it. Like if you know people in your family, it's like 5-6 people who are doing it. And PhD is like very rare. Like you might not even know a person with PhD at that time, like our grandparents' time. This was what it was. Now, the challenge right now is that probably we all are graduates, and about 80% of these graduates have a master degree, and about 40% of these would have a PhD. So the number has increased greatfold. And if the number has increased, the question is, has the job roles increased? The answer to this is what we intend to find through these, through this, like maybe my experience and also the, you know, whatever is being prevalent at this time. So career opportunity is a huge thing. When I say career, the word opportunity also comes in. You know, we say BSc, we say MSc, but at each point there is a chance factor that comes in. So you get admitted to a college or school, you get admitted to an MSc masters in your field which you want. These are all, as we call them, opportunities. But to be frank, like if we sort of widen our horizon, there are many opportunities. The question is, are we open to these opportunities? So I'll just start with my career path. So around 2002, I passed my BSc. Then I did my MSc in biochemistry. Then I did my PhD in human genetics. And because I'm a woman, and many people tend to say that, you know, being a woman, you know, you have a work-life balance. You need to balance your work life, etc., etc. So I also included my life journey also. So at 2010, I was about 27, 28 years old, and I had my first baby. Around 2012, I did my postdoc and had my second babies. They were twins. And at 2015, I actually completed my second postdoc, and I also completed my certification for genetic counseling. So you can see that my life was also not at a halt. So my life journey of my life was also progressing with the journey of my career path. So I'll just break it down as to how we did it and how I was able to do it. So as a child, I was a curious child. I loved this concept of genetics from very young. But what actually I wanted to do was, I actually was interested in dinosaurs, and I was interested in making a dinosaur out of the dinosaur DNA that was there. So actually I wanted to become a paleontologist or an archaeologist, and I was very, very inclined. Jurassic Park changed my outlook, and I wanted to become something like that. And I wanted to, you know, go into these, I was very interested in history as well. So I wanted to go into this Indus Valley civilizations and, you know, get all those things. So archaeology and paleontology was something that attracted me as a child a lot. But the opportunities in India about this field was very, very, very less, and was severely discouraged by my father, who is basically a rocket scientist. So my father is a person who was a rocket scientist who was working with Dr. Abdul Kalam, and he was the one who actually was behind the control systems of Agni and Prithvi, the missiles, in case the younger generation does not know. So then when my father discouraged me, because I was totally my father's daughter. So when my father discouraged me, I thought in terms of becoming a doctor. So I was very influenced by this fact that doctors help people. Doctors, in my idea, doctors was the ideal career path that I should be looking forward to. But then my dad came in and asked, why do you really want to become a doctor? What is your thought for becoming a doctor? So my concept was that I want to discover drugs. I want to, change their life pattern. I want to be of some use to the society, that, I can make some change to the society which suffers so much. My knowledge or my science should help the society in some way. So to that, my father said, then you shouldn't be a doctor, because that is not exactly what a doctor does. You should become a scientist. Because if you are a biomedical scientist, then these are the things which you can do. You can discover drugs, you can patent your drugs, and you can discover new pathways and help patients. So that was it. I decided to become a scientist, and hence my journey started. So I did my BSc honors. And in this part, after I completed my BSc honors from a very reputed college, fortunately or unfortunately, fortunately, I should say, not unfortunately, that I was able to be the top student in the university. But then there was a question that what should I do? So the thought of my esteemed teacher was that, if you have pursued BSc in a certain subject, you should pursue your MSc in the same subject. But the fact was, I did not really felt very close to the subject I was in. A part of our subject was a part of my subject. It was a basic biology subject. At that time, we did not have too many choices, but it was a basic biology subject. But I was not really into so much of basic biology. A part of it was genetics, which definitely attracted me. The teacher who used to teach me genetics said that, if you change your stream, it is very difficult. It's like walking on eggs, because you are the topper, and I'm saying this to you. But if you change your field, and if you do well there, you will have ample opportunities. So because the subject itself did not appeal to me too much, so I decided to change my stream to a more applied one. And in this case, I chose biochemistry. So I shifted from zoology to biochemistry. So when I started doing my biochemistry, this was a subject which I was extremely comfortable with. I loved the subject. It had both the elements I loved, chemistry and biology. And in this case, again, when I completed it, I was again a sort of topper for that particular university. And then the question again came that, should I pursue PhD in the same field, or should I go for a more applied field? Should I apply for a job, or should I try for a GRE? Let me tell you, at that time, I also got married. So money was also something I needed. So in this way, the decisions were also something like, which way should I go? Should I opt for a place where I have money, or should I change a job? Should I start a job, or should I pursue my PhD? And if I pursue my PhD, in what field should I pursue my PhD? Or I should just try and, apply out of India, because that is something that all my peers were doing. So because I had just got married, and my better half at that point did not have the opportunity to go outside, I decided to actually follow PhD. But I decided to follow PhD in the field of human genetics. A part of biochemistry was also genetics. And one of the teachers there who used to teach us was one of the very, very famous cancer biologists of the time. And I did not apply anywhere. I directly applied to him. And fortunately, I got through NET, and I was taken in his lab. So that is how my journey into PhD came into being. In 2010, I completed my PhD. So let me tell you, this journey from 2004 to 2010 was not all so beautiful. So when we do a PhD, we have to come up with topics. My problem was, I came up with 5 topics, and I needed to go on with one. And the problem over there was that my boss felt that I was a bit oversmart. and I wasn't sort of communicating with him as much as I should do. And I really had a very good PhD career in that way, because we published a lot of papers during that time with my team, both first author, second author, in a collaboration. And one of the biggest collaboration was when I published was in one of the very coveted journals like PNAS. So I knew I had done well. My boss knew I had done well, and because I had done well, there were many job opportunities at that time. So when I look at it now, understand, by 2010, I also had my first baby. So I was pregnant. I did not exactly have the baby at that time, but I was pregnant. And so the opportunities that were there, everybody told me, and I already had got selected as a lecturer with Jadavpur University, the biotech department. And I was supposed to take that up because I was told that that is a job that is something that, will make my life, will change my life, will happen, and this is not some opportunity at my age. I will not get that opportunity, the sort of opportunity I had. The other one was to not take up the job, but to pursue a postdoc, which I could do nationally or I could go abroad. And the other part was, because I had a kid, and that was the demand from many people that, I leave everything because I had achieved enough, and I take care of my kid. So among these three, what exactly appealed to me was pursuing my postdoc abroad, because I was somewhere. I started my job as a lecturer at Jadavpur University while I was pregnant, but it did not give me a lot of excitement, though teaching students was a good part. But, this regular disciplined life, it did not have any thrill. We used to go give the same lectures, answer questions, answer queries, come back. There was no thrill. There was no challenges. Challenges were all politics and administrative, which was something that did not appeal to me as per se. So at that time, my better half, he also was applying outside, and we both took a decision that, whatever happens, whoever, whichever, let us just go abroad and, pursue our careers, like if required, independently. So fortunately, when I applied, I got 2-3 positions, and fortunately, again, I say luck and opportunities. Fortunately, we got at the same place. So that was something that I always am grateful for. So I shifted outside. Now, this is where I wanted to bring in this particular part for all of you, that, there is something that you are good at, something that can bring in a lot of money, and something that you love doing. Now, if it is something that you just love doing and you are good at, it's probably your hobby. But if it's something that can bring money and you love doing, you are probably a bit delusional, and probably, you are making a compromise. If it is something that is bringing you money and you are good at, there is a small spot, which is that you are extremely happy, successful, but not extremely satisfied by soul. And if all of these three converges, it's your sweet spot. So frankly, my PDF was my sweet spot. It was something I loved to do. It was something that was bringing in money, and it was something I was definitely good at. So I was lucky to, have the sweet spot. But if I would have settled for, just money and what I am good at, I would have probably become a lecturer in an university. And right now I would probably be an assistant professor. That was what I would. And on the hindsight, it's not bad, but it was not an opportunity which I really wanted. So in 2012, I finished my first postdoc. I had my baby, and life was good, because as a postdoc student, I got a lot of accolades. I actually won. They have this NIH postdoc, award, and fortunately, I had got that award also. So if something is your passion and you're good at it, you want it. It's not without failures. We do fail every day in lab. But if you're so passionate, I'll take the dialogue of Three Idiots over here. If you're passionate about something, success actually just happens. You don't understand how it happens, but it happens because you are not really behind. Your idea is not to become successful, but your idea is actually to become good in your job and to contribute. And this is something which I understood with my life. Wherever I had given my 100%, I got back to 100%. But it's it's not linear. When I say 200%, it's not exactly linear. Neither is it as beautiful as it seems to be on these slides. We had a lot of frustration, lot of depression, lot of internal fights, lot of lab politics, lot of, your data being taken by somebody else. But at the end, if you are good at it, you have ways where you become successful by yourself. So that was my first postdoc. But, during this my first postdoc, because I had a kid and we needed more money. You can see this person on the screen over here. This is Dr. Dewey. He was my boss at that point, and he was a medical geneticist. So I used to assist in his clinic to take histories, because he was a medical geneticist. So he used to take down these histories. So all along, I was working in topics that was related to neurobiology. Like my PhD was on oncology, but when I did my postdoc, it was on neurobiology, and it was basically on the brain cells. So when I was working with him, he had the small camps and he needed volunteers, and I was more glad to volunteer because he used to pay well. So when I used to volunteer for him at that point, he just, told me one day that you're so good with patients, why don't you take up clinical genetics? Then I just asked him, how do I do it? And he said, you have to do this course. And at that point, it's a full-time course, so you cannot work. So you do your full-time course. And at that point, and after that, get your certification. You need to do clinic hours. When you are interning, I will pay you, but you need to complete the course. So that is when I did my clinical genetics course. And also, I got pregnant again with my second twins. So the year, by the year 2013, you can see me, I had a lab where I was working. I was working part-time. I was interning. At the same time, I started my second postdoc as a part-time person. You can see these two are my twins, who at that time were probably few days. This is my elder daughter. I had the car which I dreamed to have, and I really had a work-life balance, which is something which most people won't be able to achieve. So at that point, life was good. But, all good things do come with certain challenges. But what happened was I had a crisis back home, and immediately I had to come back. Without a job, I came back to India because there was a crisis which was at home. And I was told to become a scientist. But I had completed my clinical genetics course, and I also had got my certification by that time. And I was seeing patients over there in America by that time because my certification was completed. Now, here when I came back, nobody knew what a genetic counselor or a medical geneticist is. The challenge was that if you are a person who is not from the medical background, why will you sit with patients? Why will you even come to patients? Just be a scientist. Do research on human genetics and, just stay within your limits. So I was forced to think that a PhD postdoc scientist, this is my role. And in the meantime, I must tell, I also had a patent which got sanctioned. And this patent was on oncology. It was on the biomarkers, where we were actually looking for metastatic biomarkers for oral cancer. And this was a project it was an offshoot project which I had. And this, it was not my main work, but it was an offshoot project. But fortunately, that project gained a lot of national prominence. And we actually got, it was from the PhD, but, it actually got a patent after that. It was some part of my PhD work which translated into that patent, and we got that patent. But at this point, I had to come back, and I was appointed as a scientist in a lab, which the lab that I was appointed was for a government hospital. And what they wanted us to do was to, go into diagnostics, because I had a background of clinical genetics. And at that time, very few people had this. So, with whatever it was, my money at that time was very less. The salary that was being given was extremely low. But it was a government hospital. And again, everybody knows this is what you should be doing. This is how you should be doing, because this is what it is. You will not get the flair you got in US. This is not US. This is India. And this is what you should do. So again, though I started doing that particular job in that particular government hospital, I set up the lab over there. And we also had students, and we were doing what needed to be done. But 6 months down the line, it did not feel right. I wasn't feeling all right, I was feeling depressed. I was feeling that my training and what I was meant to do was all going down to drain. And so I decided that even if India does not have this genetic counseling as a profession, not many people know, East, especially from where I am, doctors were not at all open. They were very close to the idea. So I thought, as a second job, let me, try these doctors. So I had a few doctor friends, and with their help, I approached few doctors. So this is where I decided that whatever might be, I need to follow what I am good at. I need to follow my passion. So if I had seen 50 doctors, two of the doctors said that, okay, we have been to international conferences and we understand that genetics is going to come in a big way. Why don't you join us? So that made the change. So if we are looking at what it is, from that day when I used to get one patient in the entire day to what patients, the amount of patients I get now, life has changed 360 degrees. But to come back to the topic, anybody with a BSc, MSc, PhD in India right now can become a genetic counselor. But genetic counselor is not just your only option. You can become a genome analyst if you're good in wet lab, if you're good in bioinformatics, if you understand bioinformatics pipelines well, you can actually become a genome analyst. You can also become a patent officer. Lots of genetic patents coming in, lots of biochemical patents coming in. So if you are from a field of physiology, zoology, you actually can become a patent officer. And it pays very well. If there are a number of exams you need to cross, like you have to actually appear for certain exams, but you can actually become a patent officer. You also need to know a bit of law in this. So you need to have a diploma in law before you become a patent officer. So the other part is if you can become a medical geneticist or a genetic counselor. Now, but these are not your only options. These were the options which I had at my time. Right now, you have more options. More and more genetic companies are coming in. So you can become a technical scientist if you're more interested in the wet lab and you're more interested in the lab part of it. You can become the pathologist. You can also become an embryologist, which is extremely in demand because infertility is increasing, and every infertility needs, clinic needs a scientist who will do the job. These are not doctors, so you can have this course, which is a 6 months course in embryology, and you can just become an embryologist. You can become an andrologist. I forgot to put that in. Andrologists are people who analyze sperms. So you can actually become an andrologist. You can also become a clinical coordinator for these clinical trials, the phase 0 trials. This is more true from people who want to go outside abroad. There, you can just, do an MS, and from campusing, you get these jobs in very fancy places like Pfizer, Novartis, and all of these places, which actually are looking for PhDs. This for a clinical coordinator, you need to have a PhD or a postdoc. So the best way is you do your postdoc and apply to these companies. You do a postdoc in a relevant topic, which is more into these medical fields, and you can become a clinical coordinator or and be a part of these clinical trials, which are phase 0 trials where they need scientists. So this is the platter you can have just by BSc, MSc, PhD, and not follow the typical, you just become a scientist or you become a professor and you are dealing with that. So now let us understand a bit about genetic counseling. So Sheldon Reed actually proposed this topic in 1947. So initially, counseling was just, making choices, like helping people to make choices, plan or adjust. Like, Alok said right now that, we can predict things in the womb, but that is not exactly what we do. That is not exactly what our job role is. Like, it's not restricted to that point. Right now, if you look at it, what we do for genetic counseling is basically, it is actually integrating the medical field to the field of genetics, using psychological and familial implications, and also using the data science which is available right now. Also, this also involves a lot of education material. It involves testing, it involves diagnosis, it involves management, it involves prevention, the part Alok was talking about, but it also involves a lot of resource and research. So basically, we are doing this to promote informed choices and adaptation. And even if there is a person with a genetic disorder, how can we improve the quality of life for that person through informed, validated research? So that is what the job is. So basically what we do, it's a communication. So if there is a primary healthcare provider, this can be a gynecologist, a neurologist, ophthalmologist, orthopedician, anybody. This can be somebody from any of these medical fields who feels that they cannot answer this question, or they cannot answer the problem by normal methods which they have. So they refer to the geneticist, which is us, and we actually see a lot of things which I'll share, and then we refer it to these genetics laboratory, which we are also a part of. And these laboratory people will give us the reports according to what we share with them, and then we not only inform it to the family, but we also inform the clinician, and three of us come to a decision where we can either improve their life, or pitch in certain things, or some simply maybe prevent it from happening in the next generation. So basically, our job would involve collection or interpretation of family medical histories, give us access to old clinical reports which are there, like many old clinical reports or whatever they are, assess the family history, educate them about inheritance, testing, management, prevention, give them all the choices that are there, and help them take the choice without judging them. So basically, the flow. So we are the counselor, and there's the counselee. There are a lot of things that happen in between, and this we can call as eugenics, where actually we are selecting the better genes in some way, and might be influencing the nature in some way. But then this helps the family, and they can actually go into these decision making in whichever they want, in management, or not continuing their pregnancies, or, even in terms of the quality of life for late onset disorders. So it is non-judgmental. We cannot judge it. Our past cannot come here. The way we are brought up cannot come here. We have to be very neutral, and we have to be very open about, understanding the needs of the patients. We would be dealing with a lot of guilt, anger, frustration, anxiety. So at the end of the day, you do feel drained, because at certain times you also don't have anything to do. And hence the need of understanding psychology and the psychological models of counseling are extremely important. Hence, you cannot do this just with the knowledge of genetics, or you cannot just do it with the knowledge of psychology. You need both. You also need to know the technical know-hows. You need candor and honesty, because you cannot just reassure saying ki sab theek ho jayega when you know that is not true. You have to say what is what. You have to call an apple and an eye eye. But at the same time, you cannot be rude, and you cannot trash their lives. So you have to wait and see how it is going. So, and you have to be available all the time. So you need to communicate. There has to be a lot of information transfer in very simple languages. So you cannot just, give your jargons of how a next generation sequencing is done, or how you did a data analysis. That is something which you cannot say, but you have to break it down to very simple terms. Like you might be explaining to a fisherman or a rickshawala. So you have to speak their language. And you also have to think of the social, economic, religious support that there is. So here the patient gets the autonomy, not you, not the doctors, and you have to protect that autonomy. You are the person who is going to protect that autonomy. So the genetic counseling process has few phases. One is the assessment phase, the diagnostic phase, the analysis phase, the communication phase. And because these are genetic disorders, this will involve a number of people. So the referral and the support phase. Why you need to learn genetic counseling, or you have to intern in a clinic, is you need to pick up dysmorphisms. You can't just be sitting at your home and getting your certification and just becoming a genetic counselor. That is not an option. You have to be in the clinic. You have to know the physiology. You have to know what happens where. You have to know what the doctors are doing. If they say that I have started a drip of dextrose, you have to understand why that drip has been there. So you need a clinical acumen. Otherwise, you will not be able to do anything. Also, you need to pick up these dysmorphisms, because most of the doctors in India are not trained to do so. So it can be prospective, it can be retrospective. Prospective would mean screening, like before birth. It can be a newborn screening when the child is born. It can be predictive. It can, and it involves management. Diagnostics is already the child or that particular index patient already carries the disorder or already is sick, and you are trying to manage it, or give the clinician information about the management. Also give the clinician information about the pharmacogenomics. So if we are looking at applications, then we have the prenatal, pediatric, adult, and cancer. Like in US, UK, these are the branches which are there, and these pediatrics and adult will also have subspecialty. Like, there are people who will only be doing cardiology. There are people who will only be doing neurology. There will be people who will only be doing nephrology. But in India, because we are not that many in numbers right now, these are not there. So in the prenatal, it can be like carrier screening and preconception, as I said. With the adult and the cancers, it will be more with the pharmacogenomics. Now, as I said, we have a diagnostic platter. So as a genetic counselor, you first need to diagnose, and then you need to know what test to order. That is an extremely important step, because the clinicians, they don't understand the difference between a gene and a chromosome and epigenetics and methylation. So this is where your role comes in. You will help in first decoding the disease through your clinical knowledge and helping them through whatever clinical diagnostics they have done, and help them select the genetic testing. So once the genetic testing is selected, so you have done a deep phenotyping, which means you have looked at the dysmorphisms, you have looked at all their clinical reports, you have looked at the family history, you have looked at if there is any prior genetic results, and you ask for a genetic testing. The lab, according to that, would send you interpretations. You will have to do a clinical interpretations saying that whether that gene actually matches with the phenotype, so the genotype-phenotype correlation, and if it can be directly used, or it is something which is not known, and that it's of no use to the clinician, but maybe you need to research it more, or do more studies, or do more functional studies, and come back to the clinician. So normally with clinical interpretation, we have to look for a lot of bioinformatics database or bioinformatics resources. Here, the genome analyst also comes in play. And you also need to look at your local database. Like, if I'm a place like Gangaram, or if I'm a place like, Institute of Child Health, I will be having my own databases, and because there can be population specific data. So we have to look into these databases and proceed further. Counseling in India is a bit difficult, because we are people with strong religious beliefs. So if I'm maybe a Catholic, I might not support an abortion. If I am coming from a Muslim background, I cannot just ask a patient, just go for a oocyte donation, or just go for a sperm donation, even though that might be a solution, because you have to respect their views, their religious views. You can talk a bit on it, but you cannot force it. You cannot, even if it's a solution, even if it is probably the best step, it might not be best for that particular family. So you need to be very empathetic about what customs and religious beliefs they have. Also, there can be a certain patriarchy over there, which you have to somehow, not support. And if you have a patient who is a female patient, you have to see the needs of that patient rather than give in to that patriarchy, but not in a way of coercion, but in a way of logical thinking. So also there is a lot of like laws which are not there in India, which are there outside. So sometimes clinicians aren't tiff as to what to follow. So there also you need to have your own medical legal homework to protect your clinician from it, because they might fall into trouble. So because with these types of testings, also because we practice endogamy and we practice consanguinity, interpretation of these data take a lot of issues. So as back in India in early 2000, like late 2015, early 2016, that journey hasn't been bad. Kids have adjusted. I have adjusted to my clinics. You can see this is a little girl who has this condition called ichthyosis. It's a skin condition. She was getting singled out in school. She was getting a lot of peer bullying. It needed me to get into their school and talk to the teachers, talk to her friends, talk to other parents, and get her into the job, like get her into her own domain. And here you can see this is the first kid I had where we actually did come. She has a condition called SMA, and in Calcutta for the very first time we actually were able to do this particular test, like this particular therapy for her. So see, life is not bad. It involved a lot of struggle, but from clinicians not even letting me get inside their clinics to me being a part of every hospital right now is a big change. Not only that, there are a lot of families who actually we could bring about a lot of change, and it requires a lot of collaboration. It does not happen by itself. So this is a small history where I wanted to show you about pharmacogenomics. So See, this is a lady, a 43-year-old lady. She had a huge history of breast and ovarian cancer and pancreatic cancer, and she did not have children of her own, and she had an early menopause, and she wanted to know what are her risks, because there is chemo prevention or things that she can start. So we did a normal assessment, and this assessment showed that she does have an increased risk. So we went for a genetic testing. The genetic testing did include these two genes, but for the clinician, understanding this is a pathogenic one and a likely pathogenic one does not mean anything unless I break it down. So when we broke it down, we actually said what kind of drugs would work for this particular person and what kind of follow-up should be done. So these are there in literature, in many other places. So you have to do a 1 + 1 2. You also have to look into what is new, and that these germline mutations can actually influence the outcome. And that way the clinician would develop a certain certain inhibitors or certain drugs for this particular person who still does not have cancer and might not even have, because we were able to do a good follow-up and we were able to do the chemo prevention for them. So again, as I said, so this is another case. Just see, we did diagnose this particular person of a certain disorder, but then you become friends with this person. It was very difficult for her to accept it. There was a lot of suicide ideations and all of that. But again, intervening over there, once she shared these things, we started talking to her peers, her school, her college, everybody. And then she suddenly, after a certain while, like when we were liaising with her psychologist, after a certain while, she posts like what to wear because I want to go for a conference. So you see that it's just not that we can change a genetic condition all the time, but there is definitely that we can give them a life which is better. We can help them fight, we can help them accept. So this is another case where you can see that this particular child was born all right, but around a certain 4 years, 5 years of age, he started looking very different, and he had a lot of things, like he had a lot of problems which were related to his heart, his bones, and his facial features, as you can see, has changed completely. But again, when he came to us, we actually, these were older pictures, but we started this person. This person had something called storage disorder, lysosomal storage disorder, which is basically the garbage of the cellular garbage, which is there. The lysozyme has a certain enzyme which is deficient, and so it cannot break down the mucopolysaccharide. And because of that, this person has these depositions everywhere in the liver, in the spleen, which became very big, and started to have these coarse facies and a neurological decline as well. But once detected, we could give this child ERT, which is enzyme replacement therapy. And once the clinician was able to start after our recommendation, the child right now is all good, and he just celebrated his 20th birthday, and he's all fine. He's going to college. Similarly, this particular child has a certain metabolic condition called GST. See, everything, these drugs are very costly. You will know that. But if I just stop at my degree of a genetic counselor or a PhD or a postdoc, these are not in the degree. This will not give you any degree. This is patient advocacy. So if I did not involve myself therein, I wouldn't have achieved my passion. I get a lot of satisfaction when I see these smiling faces. So what we were able to do for this particular person, he already had a GST, or a glycogen storage disorder, but we could give this child some ear aids because he had progressive hearing loss, and we could help them in the diet so that this particular family, he stays with the family and he is able to have a better quality of life. So a genetic counseling job right now is expanding. So, just a certification in genetic counseling would land you up with good money. It would land you up with a good job, and definitely a lot of, recognition. But if you are just stuck in clinic, you might probably not be in the zone where you want to be. So genetic counselors can be in clinics, they can be in laboratories, they can be in patient advocacy, like I do myself. So they can, because the role is expanding, they can also be in clinical trials. They can be in management, like, for each of these drugs, as I said, you need to have the consent of the families. So you need to tell them what is exactly happening. You need to tell the doctors what drugs to give, because these are not for everybody. These are precision medicine, and each of these families will have different drugs. While you cannot prescribe them, as you are not a doctor, but you can actually help the clinician in understanding what drugs he could give, and ultimately he will make the protocol. So you are in some way being a very important part in the management, because for the clinician to take out so much time in understanding that what drugs to give and what to do in these cases, or what side effects can there be, is very difficult. But if you do that homework for them and you give it to them, they can tailor make these particular therapies and the pharmacogenomics of it, and there are many people who will be helped in that way. Also, because there is a lot of talk on the laws, on the medical laws there, we do see that we genetic counselors will be in future in the government task force and in the administrative bodies in formulating these laws. So there's a lot of opportunity in the coming field. So one thing which you also need to understand, that this is something which I totally believe, just having skill will get you nowhere. There are many people who are there with great skills. You need to understand the market. You need to understand what is hot and what is not. And you also need to have a certain passion. If it is just for money you are doing it, after a certain while, it will become monotonous. You will not have that thrill. The second part of it is just having the market and the skills. That is what will happen. You will lose it at a certain point. Having just a passion and skill and not having the market will not get you money, but you need money to survive. Though we romanticize of this idea that, we don't need money, and, this communist idea, but you also need to understand that, money solves a lot of things. If you have a family, money does solve a lot of things. Also, just market and passion without skill, you will not land up anywhere. You will just get outside by the competition you have. So you need to understand these three when you take a decision, in which way you want to go, or which way you want to, have your journey. Also, at the same time, skill, though it is needed, it's not that you have to be number one in it. Though it helps, obviously, if you have good skills and if you have passion and if you have the market, these three are the best things that can happen to you. But what you actually need is a lot of network. Skills can be all right. There are many people with very good skills who are not successful. But you need to have a very strong network. If you have a strong network, what happens is that, and these are also successful people, you are in the right, flock of people, and you do get a lot of opportunities. So if you are not in this network, the opportunities don't open up. So we call things as luck, but I call them as, if you are in the right company, luck comes by itself. So because if you're good and if you have so much of a network, you actually get a lot of opportunities, and you should never miss an opportunity, because it will never come back. You will miss the bus. It's not that I'll take this opportunity after 3 days. It will not be there. That door will be closed. Maybe others will open, but that particular door will be closed forever. So your timing and that opportunity will come if you are in association of better people. Better people, not necessarily everybody very successful, but better people in necessary that, they let you grow when they are also growing. Also understand that in this phase, you will have a lot of competition. If you put your mind in the competition part of it and not on your skill and not on your passion, you will lose out. All you need to consider is, are you doing better from what you were doing yesterday? If yes, then you will progress. And if no, then you are stagnant. So I'll say a line by Sachin Tendulkar. So, he had said once somebody had asked him that, you are like a god of cricket. So you make no mistakes. So he said, no, actually, that is not true. So I feel very guilty when I'm out. I look at how I became, how I was, bowled out, or how I was caught, because I try to judge each of my strokes and what I did wrong, so that when the next time that ball is bowled, I will not be out. I will not get out. And, I know how to play that particular ball better. So that is all you need to do. You need to be better than what you were yesterday. and you need to be a better self than what you are today. So that is how you will progress, and that is how you will achieve success. Don't run behind it. Success just comes for people who are passionate enough and who just concentrates on themselves and does not miss an opportunity. With that, I will end my presentation, and if there are any queries, I'll take that.
Awesome, ma'am. Like, it was really such a wonderful session. So yeah, ma'am, like we have one question in the chat. So
Yeah.
somebody has asked that like, can a bioinformatician be a genetic counselor?
Yes. So we have right now this whole school of genome analyst and a bioinformatician who are coming into genetic counseling. So as I said, in India, you have certain places where you can either do the course. If you do the course and if you do the internship, you can get a certification, or you can, there are many people in India, the guidelines or the rules are not that strong. So you can just intern for about 50 cases and then again apply for certification. Like, I would rather say, if you have this opportunity, then intern, go outside, get your degree in a way which is, in a more better way, and then come back and do it, or be there and, pursue your career there. Whichever way, both works.
Right, ma'am. So ma'am, I have listed on few questions. Can I ask if you allow?
Sure.
Thank you, ma'am. Like, ma'am, one of the general thing that I always interested is that we know कि genetic counseling में हमें लोगों को train करना, basically not train, basically we need to counsel them. And when we look at the from the genetics background, so whenever a patient comes to us, we need to get the familial history of the patient as well, right? So,
Yeah.
but we know like we are living in a country where we are still fighting with the mindset of the people ki like genetic disorder कितने लोग जाएंगे भी नहीं treat कराने के लिए sometimes, and so it is very hard to get the family history basically, because when
Not really. No. In India, it is actually very easy to get a family history. Because when they come to a genetic counselor and you actually tell them about why you need the history, you get it actually very well. In US, UK, where they don't know their 3-generation history, it's very difficult. It's incomplete. But in India, normally we have never faced problem with a genetic history of a family. In fact, it's oversharing rather than undersharing. So
that is fine, but will because we know all these particular advancement in the technology have come very recent. So do really the people knows ki like आज से suppose their grandparents, so will somebody so confident कि मेरे grandparent इस particular disease से suffered थे?
No, so we don't ask those questions also. So
Right.
you have to understand that when you are taking the family history, you are not asking about specific disease. The way you ask is very general. कि in general words, कि ये चल फिर पाता था, ये होके गुजर गया, ये कितने उम्र में गुजर गया, ये बचपन में गुजर गया था, बचपन में मौत हो गया था इसी को. So it's very general, very basic questions. So we don't ask about diseases as per se.
Right. And based upon the answers that you get, then you try to make some assumptions. Am I right?
Correct.
Right. So it has to be very general, right?
Yes, it's very general.
Right, ma'am. And another point is like ma'am, costing, because these things are very costlier, if I'm not wrong.
No, actually, if you look at the cost in, again, US, UK, America, the costs are, people can't even do the test. So now if I say in Dubai, prenatal testing, the Down syndrome testing, which we do at 5,000 over here, in Dubai, it costs you about 2 lakhs in Indian rupees. Okay, so there are many people from Dubai, UK, US who come here, even Nepal, Burma, Bangladesh, who come here to do the testing. So these are not right. These are myths which we have. And also right now the costs are, if you look at, you have to think it in a different way. That is why counseling becomes important. If you're doing 10 MRIs, and if you're doing 10, those things, the cost which you are incurring is much lesser than, it's much more than one genetic test. Or if you have a child who is disabled, the amount of cost you are incurring over there for the treatment is much less than the prenatal diagnostic cost. It's hugely less. It's not even comparable. So once the parents or the family understands the need, we have seen even farmers do the test. But obviously there is a small point that, there shouldn't be, what is unethical is there are people who write tests unnecessarily. So malpractice in India is a problem. But in general, these testings, as if you look at it, the budget wise, it's cheaper and it actually solves a lot of problem than creates it. So in that way, it's not a problem. But yes, there are a lot of malpractices, doctors getting a lot of money out of these tests, the diagnostic companies wrongly getting a lot of money out of these tests. Those are there. Those are there in, I guess, every field in India. So you have
Definitely,
to
ma'am,
fight
definitely.
that corruption. You can't help it.
Right, ma'am. And one last question that I wanted to ask you, like, what is the biggest challenge that you have faced till now since you came back to India and started practicing as a genetic counselor? What is the biggest challenge that you
You
faced?
see, I am from a place, I'm from East India, right?
Right.
So people are normally very closed over here. They don't want to get into the newer things. They don't want to step into the newer things because they are a bit conservative about taking up ideas. So when I came back, the biggest challenge was actually to get doctors to, let me see patients. And till a very major part of the point, it was always that why should a non-medical person see patients? But right now, those things have, improved a lot. So the general awareness has gone up a lot. There are many of us right now. In general, people understand the need. The world is changing. There are many allied therapists, not only genetic counselors. There are many allied therapists also in this same field who are doing quite well. And the scenario has changed, but there will always be challenges. So when I came, that was the challenge. Right now, as I said, the malpractice and writing wrong tests are a challenge.
Right.
Making them understand what is a good report and what is a bad report is a challenge, because they look for costs. So if a company is giving a particular test at a higher cost and a company giving at lower cost and compromising the data, they feel the lower cost is better because of the cost, but maybe the data you want is not there. So there's a lot of those things right now which are happening. Again, down the line, these will also improve. They will also understand. They will also get adjusted to what a good report is. And in general, the awareness will increase. It doesn't happen in one day. It takes time.
Definitely, definitely, totally understand, ma'am. Yeah. So, okay, guys, like it will be really great. Now you can have your questions or whatever doubts you have in your mind, so that ma'am can try or I can try to answer. Like, okay, fine. So somebody asked in the chat, which entrance exam we have to give to pursue medical genetics course in masters? So, why do she is a bachelor student?
You don't have to give any entrance exam as per se, but there's a certification test. So for MSc, you can just apply. There are 2-3 places which offer you MSc genetic counseling. So that will be based on your marks in either BSc or MSc. Kamini gives you a 2-year course. There are other places which, I think Manipal or Vellore gives you 2-year courses as well. So those are there. You just need to do the course. If you're already a PhD, you can apply for these 6 months courses which are there in HGPGI. There are courses available with CCMB Hyderabad. There's a society called CIMAG, SIMAG. So they have these courses. So you have to do those courses. No examination is needed. And then after that, you can go ahead and do the certification, which is the BGCI certification. There you need to apply for an exam and you need to appear for an interview. After the exam and the interview, if you get the certification, you can practice. So there are 2 levels, level 1 and level 2, depending upon your experiences.
Hello, ma'am.
Hello, ma'am.
Hi.
Hi, ma'am.
Hello, ma'am. First of all, thank you for this informative session.
Thank you.
Yes,
Akanksha,
I would like to
Akanksha, just a minute. Am I audible to you, Akanksha?
Yes,
It will be really great when you are asking the question, just introduce yourself and then have your question and switch to the camera if it is possible. Okay. Yeah, go ahead.
my name is Akanksha Khajuria. I have done my master's in biotechnology. So, like, from my master's, I had this huge interest in genetic counseling course, but I didn't found any course in India. Like, it was COVID times. तो मतलब मेरा प्लान वो ड्रॉप हो गया, बट आज मैंने जब लिंक्डइन पे देखा कि मतलब ऐसे वेबिनार हो रहा है, तो आई वाज जस्ट सो क्यूरियस कि कैसे होता है इंडिया में एंड ऑल. तो
so Kamini offers you a course, Akanksha. You can apply for that. Okay. Manipal and Vellore also offers you a course. It's a 1-year or a 2-year course. They are also there at this moment. You have to apply if you want to do an MSc in genetic counseling. Also, you can do these internships in different diagnostic labs or with different clinicians or medical geneticists or clinical geneticists, and you can appear for the certification course. Okay.
Okay, from where I can do the internship in this course?
You
Like,
have to apply. So, from which location are you based out of?
I'm from Jammu.
Okay, so we don't have anything in Jammu, but you can apply at SGPGI, or you can apply at Gangaram, or you can apply at AIMS. So these places you can apply, or you can apply at any place in India, like Kamini is also there, Vellore is also there. They all take interns. So, or you can just apply personally, like, to some clinical geneticists, like the army hospital also takes in. So you have to personally approach them. So if they take you up for an internship, then they help you to do these courses also along with those internships, especially Gangaram has a course. So you can do an in-campus and out-of-campus. You can also apply if you're interested in oncology. You can apply to Dr. Rajiv Sareen at Tata. They also take up courses. So they also take up interns and they train very well, and they also look for even campusing with them. So if you're good enough, they will hire you. So there are a number of places where you have to personally, write to them and see whether they take you up. If they take you up, then you can just after that go for a certification and it will be done. Okay.
Okay, ma'am. Thank you so much.
Most welcome.
Hello, ma'am.
Hi.
Hi, I'm Nisha. Thank you so much for this insightful talk. I'm currently pursuing my master's in genetics from DU, and I've always been interested in genetic counseling. So I took up the genetics course in order to become a genetics counselor. But then I saw that in India you don't have that opportunity, and moreover you have to clear a license test, which doesn't happen in India. It only happens abroad. So does doing MSc in genetic counseling, like you said, will it help in becoming a genetic counselor? Also, can I be a separate genetic counselor and open my own practice, not being a part of the hospital?
Two answers to that. Number one, if you want to practice outside India, you need a certification of that particular place. Say I am certified from USA, I can practice in USA. If I'm certified in USA, I'm also allowed to practice in UK. If I am certified from Australia, I'm allowed to practice in UK but not in USA. So each of these places have their own certification and it has to be there. It is a wrong information that India does not have a certification course. India does. The only thing is that it is not nationally recognized. The course is there. You can all look at it. It's called BGCI, Board of Genetic Counseling India. And the BGCI actually has its exam in July. For that particular certification, you need to do an internship. And once you do an internship, you have to submit a 50 case log and certain reflective notes. And you need to do a psychological internship. And once you do that, you can apply and you can get certified. But that is only for India. That certification is not valid anywhere outside India. That's basically used nowhere. Okay. So, but like if you do it from outside, if you are an ACMG or ACOG or NSCG certified counselor, then you can practice in UK, US, and if you are certified by the Australian board or the Singapore board, then you can practice in those areas as well. So, unfortunately, the Indian certification, because it's not a national certification, is not validated anywhere. So that is one problem. Coming to your second question, whether you can practice as an individual, the answer is that yes, but only after a certain time. So these certification come in two levels. There is a level 1 and a level 2. So level 2 is when you can, if you get certified by level 2, you can practice individually. As I said, in India, there is no real laws present, and there's no national body present. So if you want to practice by yourself, you can, if you're not wanting to practice in a hospital. But then Nisha, who is going to refer you patients? It's this is a referral center. Like, you are not the person that anybody will just walk in. So and also there are diagnostic companies who offer free genetic counseling. So because there are no laws and because diagnostic companies, are giving it for free, uh, setting up an individual clinic, like I with my patients also, I would give it like a good thought. Because if you understand the sentiments, no doctor would refer to a standalone center. So that becomes a problem. See, first, we are not medicos. Second of all, this is a totally reference-based practice. So to secure yourself, you need a hospital affiliations.
Okay, ma'am. Thank you so much. Really enjoyed the talk. Thank you
Thank
for
you. Thank
giving
you.
this.
Yeah, but Nisha, please be
Good
brief.
evening, ma'am. Dipanshu here.
Hi, Deepanshu. Please tell me.
Ma'am, your session is very inspiring, and I must say your journey is quite interesting, and it gives me goosebumps. I must say, like you have done so much in your life, and I am just tired of giving two interviews, which in one I got waitlisted, and in another one I didn't select. And I thought, what is the scope of doing masters if I didn't pass an interview? But after seeing your journey, I just totally changed my mindset,
Thank you.
ma'am.
That's a good thing out of this session, I would say.
And ma'am, my question was also the same, ma'am. Do you think of opening your own clinic
At this
someday?
point, no. At this point, no. See, it's a reference-based practice. What I try to do is I try to collaborate with many people. And I see, you also have to understand that whenever you are opening your own center, it's you have to take a government approval. Okay, so there's a lot of money involved. So you need to get a PCPNDT approval. So even if you are practicing, you need to submit your credentials to the health department right now, and they need to be approved. So opening up a center comes with a lot of how do I call it? A lot of issues and problems and business. Until I find somebody who has a better business acumen than me, opening up a personal clinic at this moment, I don't think it's a very viable option for me. I have 3
So,
kids, remember. At the end of the day, I need the
yes,
money.
ma'am. Yes, ma'am. Yes, ma'am. And ma'am, one more thing that you are saying that government bodies being set up and many other things. So, are you seeing any change in these things, like in genetic counseling, that one day you and I can be a part of that body?
Yes, see, already, I'll tell you this in a very different way. So, see, when I started in 2015 in entire India, there were only 60 people who were counselors, genetic counselors. Okay. Right now, the number is about, if I'm not mistaken, it's more than 200, number one. Number two, right now, we don't have a problem looking for jobs. Like if you want to leave one company and go to another company, you want to leave a particular hospital and go to another hospital, because of the scarcity, you have a lot of jobs. So job is there. Also, there are these centers coming up, left, right center, the fetal medicine center, the IVF centers. Everybody wants a genetic counselor, in-house genetic counselor. So that way you have a very good future as far as, what we had seen. Like in 2015, when I had started, we used to get one patient the entire day. Now I have about, people booked on till 2 weeks from now. So obviously, and it's just not me, it's everyone. Like it's not just about me, it's about everyone. Even with all this free counselings going on with all these companies, so everyone right now has a lot of cases. So now, because you know that the rare disease policy has come in, and there are many policies which are following, government policies which are following, and many clinical trials and many companies bringing in these policies. So, influencing the government to take up these policies. So, definitely, government needs a body where they will have these kind of, individuals. But as you understand, who will be those individuals, nobody knows. But yes, in future there will be a requirement, and yes, people like you and me, if we are good enough and if the government thinks that we are able enough, we will be there. So I am in my state disease rare disease task force. So I am one person who is there in the state rare disease task force. But who was rather, because the task force gets sort of evaluated every few years. So I was a part of it. But if you are following a lot of things, if you are an advisor in a lot of places, if you can see, you also have to sell yourself. You just practicing in your own clinic, you will ultimately probably not get through. But you selling yourself shouldn't be selling your ethics or selling your soul. You selling yourself would mean that you actually doing good for the society. If you can't do that, then expecting somebody to approach you is also difficult, because you see, everybody understands if you will get benefited out of it, or you are just there for the benefits and not there for the work. So it takes a lot of effort, to support patients. It takes a lot of effort to bring about a change. It takes a lot of effort to even go against a lot of people. That job is not an easy job. So going against people where you actually want to bring in a change, it means a lot of sacrifice as well. So if we can do that, then yes, maybe in a government body someday, not
Yeah.
very far.
Yes, ma'am. And ma'am, one just last question. Like
Devanshu,
we
could
are
you
not a part of medical association and we are not a doctor. So does it affect your mental health if you couldn't solve a case, like if some has genetic diseases and it, like, somehow everybody is emotional. So
Yeah, so that is the reason why self-care is something which you have to understand. So while empathy is good, you also need to understand you are not God. Even a medical person cannot save every person. Even a surgeon cannot save every patient. So the intent has to be there. Even in medical laws, the term is not whether you can save or whether you cannot save, whether you can cure or whether you can't cure. The entire thing is about the intent. So two things can happen. One thing is that it is beyond you. Like whatever infrastructure you have or knowledge you have, it is beyond you. So then reach out for help, collaborate with somebody else. It's not that everything you can solve everything by yourself. So that is one. And that is how you grow also, as I said, the network. आप एक case किसी से collaborate किया, that person is best there. That person might collaborate for a second case with you. So you're opening up the doors over there. So that is one. The second part is that there are places where you actually can't solve. Like obviously half of the genetic disorders are that way, but you can obviously be empathetic, correct? You can obviously be empathetic and you can listen to them. So I had a patient, who had a child with Edward syndrome. And the child had something called, you have tumors in the liver and everywhere. That's the last stage. And we knew that child wouldn't survive. That person called me when the child was on the ventilator, crying profusely. And I was in the middle of a consult. But the empathetic thing to do, or what I did, was just to hold the phone call and listen to him. I didn't have to say anything at that point. But all I said was, I'm sorry, but this is happening to you. And I wish it was in some way different. And, he cried and cried. It was about 45 minutes. Then he himself said that, madam, I'll call you after a certain while. And then he called me at night again. And again, he started sharing his life, how difficult it was. And I just listened and, just spoke as a friend. There was nothing else to do. But after he buried the child, after the child expired, he buried the child. One day talking, he just said that, the grief is too much. So I said, why don't you speak to the psychologist? Because, I feel if you cannot overcome the grief, because at that time he was in grief and the grief was what all he had. He couldn't even speak. He was not able to go for his job. So I said, why don't you go to a psychologist? So he went to the psychologist, because by that time, see, he's looking to me as a friend. And then he came back saying that, the psychologist I spoke, but, I feel more comfortable speaking to you. Can I continue speaking to you? He said, okay, that's not a problem. So one of these days when he texted, I just asked him, why don't you get a dog? I understand the sense of, you are not feeling, you're feeling empty somewhere. So why don't you get a dog? And he actually got a dog. And once he got a dog, and with his therapy going on, he improved. He again went off to have a second child, and that child was all right. But you see, there are sometimes when you can't do anything, but you can be with the family. You can obviously stand by. So, and not everything is chargeable. So all these conversations we don't charge normally. we might say ki call back after some time, busy, we'll talk at night. But this is something that every one of us does, every one of the genetic counselor does. So yes, on you it takes a lot of for you it is a lot of time which goes, and you yourself need to concentrate on you and understand how you can keep your mental health all right. But not everything is solvable, and it shouldn't come on you.
Definitely.
It can frustrate you, but not everything is solvable.
Thank you so much, ma'am.
Great. So ma'am, we will take only two to three more questions then, like, because I know it's lacking of time. So Nilofer, can you please unmute yourself and have your question, or shall I speak it up? Nilofer, are you there? Yeah, Nilofer, are you there? Maybe she's not there. So she's simply asking that what are the skill sets of a bioinformatician should have in order to be a genetic counselor?
Okay, so skill sets a bioinformatician should have is something that a bioinformatician does not need to have, because bioinformatics, you need to know the genetics part of it, definitely. One is that. Second is that you come with a very useful skill of understanding the variants. So that is a very useful skill, but you need to understand the skills for counseling, psychological counseling, and you need to have a bit of clinical skills for understanding what kind of disease we are looking at, what dysmorphisms are. So these should be your skills, but you come with a very important skill of understanding the variants, which many counselors will not have. So that should be your USP. And the other one should be the counseling, the clinical part of it, the clinical acumen of it. That is something you should know, and the physiology. So if you have all those, that will be helpful for you.
Right. And one last question is there, ma'am, like what are some of the, like this is from your experience only, what are some of the frequent diseases, rare diseases that you have come across in your career till now?
Okay, so rare diseases which we have come across, Noonan syndrome is very common in India. You will see Williams syndrome very common in India. We see George, which is very common in India. There are certain other rasopathies which are very common in India. There are the nephrotic diseases which are very common in India. There's something called a nephrotic disease. There's something called a cystic kidney disease which are very common. So these are, we see them regularly. Muscular dystrophy is very common. SMA is common. So these are only things which we see regularly in clinic.
Yeah. So I hope we have covered all the questions. So guys, anyone else have any questions or anything to ask, feel free to like unmute and have a session. Because as ma'am introduced in one of the slide, networking is one of the most important thing nowadays. No, not nowadays, from the past even, like you should try to build network. And one of the most important aim of us to conduct such sessions in networking, so that we can reach out to the student can reach out to us, and then we can connect the student to some of the experts in their domain. Okay, so it will be great if you can have some question, or if you think that you are not comfortable in asking the question right now, you can definitely write to us over emails. Okay, so and then we will transfer those emails to the ma'am or whatever you guys think, and also you can reach out to her over LinkedIn. Is it right, ma'am? They can reach out to you over LinkedIn.
Yes, yes, for sure.
Sure. So you can definitely reach out to her over LinkedIn. And ma'am, it will be good if you can just write your email ID here in the chat.
Sure.
If somebody is interested to have a detailed or want to ask something to you, they can write an email to you, right?
Yes.
Definitely. Yes. And guys, like, yeah. So guys, we keep on conducting such sessions, and now we are also in communication with some of the faculties who are AI experts. So we are planning to conduct some events in the field of artificial intelligence. So it will be good, like if you follow us over LinkedIn, so that you can get the updates over the coming event that we will be conducting, and stay in touch with us, and try to increase your knowledge and make yourself a little bit interdisciplinary, because the world is of interdisciplinary. You have to understand the different domains. You can't be the frog of a well. Okay, so आपको बाहर निकलना पड़ेगा, नई नई चीजें सीखनी पड़ेंगी, and try to value each and everything. So it's all that I want to say. So even if anybody have anything to ask, feel free to ask. Otherwise, we can end the session after a photograph. Okay, so anyone? Yeah. Prakriti, would you want to say something?
It was a really great session, and actually, I learned a lot. It was really insightful.
Thank you.
Yeah. So, ma'am, let me little bit introduce you to my team. Okay. So it will be good. Like I think that we have covered a lot of questions. So definitely you know me now because we had a conversation over call. So Prakriti is basically the technical person of our team. She manages all the website and also she is a data scientist at our team. So she's interested in teaching data science and she's basically now got placed in ICICI Bank recently. She's a
Oh, wow.
yeah, she's a BTech scholar from Triple IT Delhi only.
Wow. Very nice.
Yeah, and she's highly interested in genomics. Let me tell you, basically.
Awesome.
Like she keep on working with us in the lab, so she's very highly interested in the genomics field. Right?
Awesome.
Yeah. And then we have also one of the guy here, Aditya. Hey, Aditya, are you there?
Yeah. Look, I'm there.
Yeah. So Aditya is basically the marketing person team. Like he was the person who found you over LinkedIn and told me that it will be good if you connect with you and ask you for a particular session. So he's the complete marketing person who keeps on finding people, experts in the domain, so that we can conduct few sessions with them. And he tries to get us in touch with the companies and all the technical things. Basically.
Okay. Nice.
Yes, ma'am. Yeah. So it is basically because of this teamwork only that I'm able to conduct this session. Otherwise, definitely these things are not possible. You can totally understand. Right. So students have to give money for internships. Like these are the things that you should Google basically. Everything should not be answered. So आपको थोड़ा बहुत Google करना चाहिए. Try to find the answer by yourself also. Okay. So Karthik, short term, all right. Yes. I want to know there are any internships for bioinformatics or genetic engineering where students get paid short term internships.
In India, there is no paid internships, unfortunately, but you can do internships in these different labs. They allow you for with the exchange of certain money, and they also hire you if you are good. So after they hire you, you will get money.
Definitely. To this question, I would like to add one thing only that guys, like when you are trying to look for the paid internship, always try to look from one angle there as well. Okay, because now I'm running as a company, so that I would like to add here that whenever a company is going to pay you, they always try to look for all the complete skill sets that are required for that particular job. Okay, because internship is just a word there because they are going to expect from you that you carry those skill sets. You carry all the skill sets which are required for that particular job. Okay. So, and then only they'll be able to pay you. So I will highly recommend you guys basically that if you are a bioinformatician or if you're in the field of bioinformatics, start developing your skill sets in a very high manner, like thoroughly, and then start approaching the companies, not the labs basically. You will have to approach the companies, the startups. The startups might get agreed to pay you even in the beginning, but the good companies even they will not basically entertain you in the beginning. Okay, so I will highly recommend because now we are in touch with so many companies. I will highly recommend you start building on your working on your skill sets. Build your skill set in the field of computational because when you are approaching as a bioinformatician, they will expect you to know very high skill set in the field of computational skill sets. Okay, you need to understand genetics, molecular biology in depth. Okay, and genetic counseling definitely it's somewhere related to medical and the related to the patients. You need to carry little bit good experience. And as ma'am has explained everything in detail, first you need to basically get the idea like what is all genetic counseling and start looking into the patient and getting interaction with them. Okay. So, but there are very few internships in bioinformatics which will pay you. Okay, bioinformatics, very few internships will pay you. Would you be able to have the access to the recording? Yeah, you will definitely have the access. So we will basically upload it to YouTube in the coming time, and we will share an email. So you should follow us over YouTube. And I have. Can you mute yourself, please? Yeah. So hello. You're fine. So I have posted the link of the YouTube channel in the chat. You can follow us over there, and we'll upload the session over the YouTube in the coming few time. Okay. So after processing this lecture, we will proceed over the LinkedIn. So yeah, thanks all of you for joining the session.